Loud. Okay. All right. Perfect. Now, when we're looking at the lymphatic system right here, keep in mind that, right, we're looking at the lymphatic system in terms of it's got a couple different functions. And one of the functions we kind of understand that it does is like it allows us to uh, fight any kind of infections, that kind of stuff, right? So immunity is one that we kind of already kind of know a little bit inherently, right? Lymphatic system. Other things are kind of weird. Number one is when we are eating and we are absorbing nutrients, when we absorb carbohydrates, glucose, galactose, fructose, when we absorb amino acids, we bring it directly into the bloodstream. Right? We have capillaries in our GI tract. That's main purpose is to just allow all those nutrients, the carbs and the amino acid to go in. The weird thing is fats doesn't go into those capillaries right away. Instead, fats gets funneled into modified lymphatic vessels called lacteals. So one of the weird things that we normally see is that, yeah, in order to have fat absorption, we need these lacteals to be intact. All right. So it is important in terms of getting dietary lipids and transferring it from our small intestinal cells. It goes directly to the lacteals, which are lymphatic organs, right? And then the lacteals will eventually, right, lead to the thoracic duct, which then is going to allow you to empty fluids as well as fat into the subclavian veins. So we will introduce it into the bloodstream eventually, but immediately, though, you don't absorb it into the bloodstream like all the other nutrients. Immediately upon absorption, it goes into the lymphatic system first. Now, the other thing is this fluid recovery, right? Fluid recovery, fluid continually filtered from blood capillaries into the tissue spaces. 85% of blood capillaries are going to get filtered out water, and then we're going to reabsorb it, right? 15%, about 2 to 4 liters of water, and half of the plasma proteins enter the lymphatic system and is returned to blood. So 2 to 4 liters a day of fluid that will normally rest in our cells, right? That are normally rest in our interstitial space. Now, it's hard to imagine this, but some of you guys have been at work at times, standing on your feet, and the next time you get home, right, you take off your socks and you notice that your legs are swollen, right? The reason why is when we have a little bit of edema in the lower legs, that's fluid in our interstitial space. So when we talk about fluid in the interstitial space right here, right? That is, if we don't get rid of that fluid, it becomes edema, right? Most of the time, we have lymphatic capillaries able to move that extra fluid back in, right? So then it doesn't just sit in that interstitial space, causing you to have edema, right? Now, in the lower legs, it's a little bit harder because of gravity, right? But in the arms, most of the time, none of us ever gets edema in the arms, right? Because gravity helps to bring fluid back to the heart. And we'll talk about certain times when we can get some massive amount of lymphedema in the arms coming up. So no, and then the function that we kind of know about a little bit more detail is immunity, right? Excess filtered fluid picks up foreign cells and chemicals from the tissue. Then it gets passed to the lymph nodes where the majority of our white blood cells are found. All right, so this is actually pretty good right here. I'm just going to highlight it again here. All right, now, you ever wonder why when you get a cut, all right, not only does it bleed, but it swells up, doesn't it? Right? And you're wondering, why is it swelling? And most noticeably, if you get a cut in the face, get a cut in the arms and fingers, if you ever get a cut on your lip, you'll really notice it, right? I used to be a wrestler in high school and a wrestling coach. And when I was in high school, I would wear braces. And, I wasn't always in the greatest shape. So what happens is in wrestling, you have to always be in good shape. And most of the time, if people wear braces, they have to wear a mouth guard, right? The problem was mouth guards, kind of restrict air coming in, right? So I didn't wear it a couple times. And when people see you with braces and you're a wrestler, right away, they just want to hit the living hell out of your lip, right? So every week, my lips were just swollen, right? And if you've ever gotten any cut in your lip, you'll notice how much edema actually goes in there, right? And that's there for a reason. Anytime when you have a cut, you have a little swelling in that region. Why? Right? Simple. Because most of the time when you get a cut, you're cut with something that's not sterile, right? You cut your finger when you're cut, trying to, all right, cut out some onions or something in your kitchen. It's not a sterile knife, no matter how much we think it is. Or even when it's sterile, when you're in surgery and we're using an autoclave scalpel, right? Well, we still get actual infections at the site of incision. Why? Because anytime you cut yourself, you're exposing the dermis to all of the actual bacterium that lies in our epidermis, right? And now you exposed it by pushing down on it, right? You expose it, and now the bacterium is going to hopefully get pushed in that area. That area then swells up with fluid. And what happens when that area gets swollen up with fluid, right? It goes into the lymphatic system. As it goes into the lymphatic system, that excess fluid, right, goes into the lymphatic system along with the bacterium that you're exposed to. And now you have this fluid-filled region that's full of bacterium, and now we're funneling it into the lymphatic system, right? As we funnel into the lymphatic system, in the lymphatic system, we have a series of nodes. That's what we're feeling here, right? Anybody's ever been sick when they were young? Your mom and dad touch your neck, and they're like, oh, you got swollen glands, right? Are there any glands at the top of your neck, right? You have the thyroid gland, but that's, I mean, if your mom and dad can feel the thyroid gland, they're pretty good, right? You're not going to feel it, in other words, right? What they're actually feeling are lymph nodes. And the lymph nodes are swollen for a reason, because you have a sore throat. And because you have a sore throat, there's edema in that area. That's why it's so hard to breathe, right? And now you have all that fluid-filled region full of edema, bacterium or viruses as well. Now it gets flushed into lymphatic nodes. The nodes are where the majority of your white blood cells are. So now you're bringing bacterium into the region where you can actually fight it off, right? Perfect. And when we see the swollen nodes, it's actually a good thing. It's a sign that your body, all right, is noticing the bacterium, and now it's mounting an immune defense, right? And it's a sign that you're, sick, but at the same time, you can defend yourself, right? So here's the lymphatic capillaries and how they're kind of interspersed with the blood capillaries. So there's the blood capillaries coming out from the arterioles, right? You have a little bit of water that kind of stays out in the interstitial fluid region right here, right? 2 to 4 liters of that fluid goes into the lymphatic system every day. So then you can drain that region. You want a little bit of fluid in the interstitium, but you don't want it so then there's so much of it, it causes edema, all right? All right. Lymph is the name of the recovered fluid. Lymphatic vessels are the name of the way we transport it. All right. So none of this is highlighted because we're going to talk about it specifically in lab. Right. Lymphatic organs are especially concentrated in white blood cells, so then we can fight off infections. Right. Now, what does lymph look like? Right. Lymph is clear, colorless fluid, very similar to plasma, but with very little protein. Right. It comes from extracellular fluid from the interstitium, right? Interstitium is that fluid that we see that's between our cells. Now, most of the time we don't see it, but you ever get get rug burn, right? Or get a very, very shallow cut where you don't bleed, but this kind of yellow liquid comes out? That's interstitial fluid, right? That's the kind of fluid that we see in lymphatic fluid, right? Now, lymphatic capillaries, they're the terminal sacs, penetrate nearly every tissue in the body, right? Important thing about the lymphatic capillaries is that, right, they are closed at one end and they have overlap of cells, right? The overlap of endothelial cells create a valve-like flap that opens when interstitial fluid pressure is high and closes when it's low. What the heck does this mean? Simple, right? Let's take a look at the next slide right here, and you will see what the overlap means. So here are the cells, that make up the lymphatic fluid, the lymphatic vessel. Simple squamous epithelial cells. See how they overlap right here, right? So there's a part of the cell that actually comes out right here. And then a part of the next cell that starts over here, but it kind of covers up, right? Why is this important? Simple. When there's a lot of fluid, it pushes those flap internally. It squeezes it. As it squeezes it, that excess extracellular fluid squeezes the flaps inside, causing more fluid to go in, all right, to lymphatic capillaries. Now that you have a lot of fluid in the lymphatic capillaries, what happens, right? It creates pressure from the inside out. So then the fluid that's coming in, right, forces the valves open. So then there's flow into the lymphatic vessel, but the fluid can't flow out, right? So these valves allows us to direct flow into the lymphatic capillaries and then direct it into the lymph nodes, right? And eventually we're going to return all the fluid into our bloodstream, but that happens a little bit further after we've filtered it. Right, so lymphatic vessels right here. 6 lymphatic trunks, 2 collecting ducts. And these are the ones I want you to know. We have a right and a right lymphatic duct and a thoracic duct. Right? The easiest way to understand it is the right side, any fluid that we have from your right arm, right? Right part of the upper chest, right? Right thorax, right head area, right? Any excess fluid that we have in those regions, right? Right upper body, basically, right? Any fluid that's kind of, returned and it goes into lymphatic system from that side will go and return back into the cardiovascular system by way of the right lymphatic duct into your right subclavian vein. Remember, this lymphatic fluid is going to be very similar to plasma. So it gets easily incorporated back into the bloodstream. So the right lymphatic duct is a drainage for all the excess fluid on the right upper body. The rest of the body, all of your lower body, your abdomen, the left upper body, all of that excess fluid that we have, right, returns by way of the thoracic duct. Right? Now, we do have a dilated sac in the abdomen called the cisterna chyli. That's where all of the fats that we absorb will be filtered into the lymphatic system. Right? The thoracic duct empties into the left subclavian veins or subclavian vein. Right? So here's a lymphatic duct coming up. We have a model that shows it a little bit better. Right? Here it shows it in yellow. Now we can't even see it because all you see is a yellow. Right? So here's just kind of showing you where things are. So you have these up here, right? The anterior cervical nodes. These are the nodes that your parents feel, right? When they think you have a sore throat, right? Now, the big one are these axillary lymph nodes, right? Back before 1980, any woman that would have, all right, a mastectomy because of breast cancer, right? They would get a full mastectomy, double mastectomy, and they would remove all of the lymph nodes, right? When we have any kind of cancer, a cancer is only dangerous when it metastasizes. It doesn't matter how big a tumor gets in one spot. It's actually a good sign that a tumor gets really big in one spot, right? It's a sign that it usually hasn't moved yet, right? When tumors are dangerous is when they metastasize and become cancers, right? With breast cancer, the most common method of metastasis is through the lymph nodes. So what we did back then was removed all of the lymph nodes, including the axillary lymph nodes on both sides. What's the problem? Right? The problem is by removing all the axillary lymph nodes, all of the drainage of lymphatic fluids from your right and your left arm now, right, cannot get through. So women were getting lymphedema in the arm. Or God forbid, right? You do blood pressure. When we do a blood pressure, right, what we're going to do with blood pressure is, right, put a lot of pressure on that bladder, right? And what happens? It creates a lot of tension, a lot of water movement out. all right, of the arm that we are testing for with blood pressure. So the more you pump up that bladder, all right, you pump it from 0 to 180, the more the arm will swell up in that person. The problem is this, right? For us, it swells up a little bit, and then any excess water can get returned by way of these lymphatic vessels. All right. If it's the right arm, all that excess fluid will go through the right lymphatic duct into the subclavian vein. Perfect. But what happens if you don't have that connection anymore? Right? The arm will start swelling up and keep swelling to the point where it's almost not movable, right? So if you've ever seen an older woman and they're wearing like a what looks like a nude sleeve, right? It's a sleeve on the arms, right? That's a lymphedema sleeve. And what that does is creates a little pressure, right? From the sleeve creates pressure on the skin, right? Because it can't have the lymphatic fluid, return that fluid back to the subclavian, the sleeve provides pressure. So then all any excess blood gets pushed back into the blood capillaries. Right? That sleeve is to prevent lymphedema. Now, if usually all it takes is one instance, right? That woman that's had double mastectomy, they've had their axillary nodes removed on both sides, right? You have one mistake where the person, the nurse, didn't read the chart, and now they're doing blood pressure testing on the arm. The arm swells for about a year, right? Then it starts to decrease in size. Well, guess what? If you're going to take the test, the blood pressure reading again, do you think they're going to let you even touch the arm? No, right? So how do we do blood pressure tests on these double mastectomy, right? Axillary node negative patients? You have to do it in their leg, right? You have to do the femoral. But if you're sitting down and you're doing the femoral, guess what? Right? You're always going to have high blood pressure. So what do you have to do? You have to lay them down, right? Lay them down prone on their back. At that point, the legs and the heart are at the same level. By the way, that's the reason why we test blood pressure on the brachial artery, right? Because the heart and the brachial artery are at the same level. All right, so here's that thoracic duct. Here's that cisterna chyli that allows us to bring that fluid in from the small intestines. Right now, inguinal and axillary nodes are also something that we see every now and then with people. You guys have probably read or had, Eastern European history when they talk about the Black Plague, right? You guys know that the plague actually happens from time to time, even now. Right now, it's just treatable with just penicillin. Right? Isn't that crazy? Like our weakest antibiotics can kill this scourge that killed, hundreds of millions of people, right? Almost billion back then. So what happens is with the Black Plague, right? They call it bubonic plague. It is caused by, right, a bacterium that would seed itself in the axillary and inguinal nodes. And these areas then will start to swell up, right? And it becomes black, right? Buboes, they call them. And you would hear stories of somebody getting the armpits are turning black and then it becoming swollen, right? Right away, they have bubonic plague. The great thing is when we treat it now, it's so eminently treatable with just penicillin, right? That's enough to just cure them. Flow of lymph, right here. Lymph flows under forces similar to that governs venous return, right? So the same skeletal muscle pump, the same thoracic or respiratory pump that allows blood to return from the veins of the lower limbs is the same system that allows lymph to flow back. So then we can reincorporate that fluid into the subclavian. Again, I'm going to highlight this because I do want you guys to know it. Right. Again, so in a lot of ways, lymphatic vessels are very similar to veins, right? All right, lymphatic cells. We have lots of lymphatic cells. Lymphatic cells are white blood cells, basically, right? We need to know what NK cells are, and in general, what T and B cells are, right? In general. Right, we're going to talk to a little bit what they do coming up. right? So natural killer cells, these TMB cells, they're very specific. They have receptors that recognizes specific proteins that are found on a specific type of bacterium, right? So what we recognize, so when you hear about our cells being able to recognize specific bugs, right? They don't recognize the whole bug, right? If you have a bacterium, well, bacterium are about the same size as a white blood cell. How are you going to have a receptor the same size as your cell? You're not, right? So what we notice is, right, when a white blood cell recognizes any kind of foreign pathogen. It doesn't recognize the whole thing. It doesn't recognize, right, streptococcus as streptococcus. What it recognizes are proteins found on the surface of streptococcus. Those proteins have a specific shape to them, right? Those shapes you can see maybe in streptococcus. You can also see it in staphylococcus, right? So one cell can activate and kill off both, right? So what we have are receptors that recognize those proteins found on the surface of those foreign antigens, foreign pathogens, right? Bacterium here, right? So those proteins are called epitopes. So for a large bacterium, you might have a few thousand different epitopes, right? A few thousand different epitopes means you can activate a few thousand different cells that recognizes it. Not like if you recognize one cell with one whole, bacterium, right? Number one, if one cell recognizes one bacterium, how are you going to find that one cell? Right? We have trillions of white blood cells. How are you going to find that one cell that recognizes the bacterium? You're not, right? By the time you find it, you probably die, right? So what we find now is that we don't recognize one whole bacterium, right? We recognize epitopes on that bacterium. So we can find thousands and thousands of different cells that recognizes parts of the different epitopes, right? And what's good is that, right, instead of just one cell, we have thousands. And when we find those cells, right, instead of activating one cell and form clones, now you have two, now you have four, right? How long will it take until you get a billion, right? Forever. So once you find it, you have thousands of different cells you can activate. Those thousands of cells can form clones. You can form 100,000 really easily, the millions, the billions really easily, right? And now we can mount an immune defense because we have enough cells, right? Again, when we talk about specificity here, when we talk about T and B cells recognizing, right, something, they don't recognize the whole bacterium. They don't recognize the whole virus. They recognize specific proteins on the bacterium, on the virus. The good news is there's a lot of different proteins, so we have a lot of different cells that we can find and activate. The other good news is because of our genetics, our parents have already, right, encountered these bacteriums, even if we haven't. Their parents have encountered other bacteriums when we haven't, right? We already have the cells that we've inherited from them that have the receptors to recognize all of these different, right, epitopes, right? So you have a baby that's 6 months old, right? They already have every single cell that recognizes all these different epitopes, right? The reason why we all get sick, though, is we have to find the right cells, right? The hundreds of thousands of cells in the trillions of white blood cells. That still takes time, right? Now, NK cells are pretty cool because they are non-specific, right? What they'll do is they'll look at classes of bacterium, right? So bacterium have certain receptors and proteins that is conserved through all the different bacterium, meaning they're the same. So those proteins are the same, right? Doesn't matter if it's staph, strep, but mycobacterium, right? They'll have the same proteins found in all gram-positive bacterium, right? Then these NK cells recognizes those non-specific epitopes. So then they'll activate, right? They don't recognize its staph. They just know that it can recognize it and kill it, right? If you have streptococcus infection, these same NK cells can recognize those proteins, right? They don't recognize it's strep, right? They just recognize that you get these different proteins on there and they start killing anything with those proteins, right? Now, these NK cells are good in that they allow us to have immune surveillance. So they're there to kind of make sure there's no overgrowth, hopefully, of cancers, right? They're bad because these are the reasons, right? Why we have, host versus graft, right? Kind of organ transplant rejection, right? So we get rejection of organs. It is these cells that are doing it, right? They're going to recognize our different type of cells in our body, and as they recognize the cells of our body, they will hopefully, right, recognize this is a host cell. This is part of our larger body. I can't kill it, right? Now, once we start displaying something different, when we have a virus and when virus infects our cells, right, the virus will take over our machinery and start producing viral DNA and viral proteins. So how bacterium damages us and how viruses damages us are different, right? Viruses cannot self-replicate. They don't have the machinery to produce more of itself. Bacterium, as long as there's enough glucose, right, it can reproduce itself easily, right? Viruses can't. Viruses has to go into our cells, infect the cells, take over the protein synthesis, DNA replication of our cells. And once they do, they turn our own cells into viral cells, right? And then we start making all these viruses for them, right? In the process, we've changed our cell, right? As we change our cell, we're going to start putting different proteins and receptors, right, on our cell. And that change in protein receptor is what these NK cells notices. And it will start hopefully going around, notice that, wait, your cell that should be displaying my protein is no longer displaying my protein. You're displaying the virus's protein because the virus has taken over, right? What happens then? Well, now that there's that switch, these NK cells hopefully will go around and kill that infected cell. Because if it doesn't kill that infected cell, we keep producing viruses. That's not good, right? Now, one other thing. If we don't kill that virally infected cell, right, they can turn into cancers, right? You guys as in all the women here, right? All have heard of HPV, human papillomavirus, right? We know women that are exposed with HPV early in life are more likely to get cervical cancers later on in life, right? That's why we're doing the vaccinations right now, right? Is because when you have a virally infected cell, you're overall changing the machinery inside the cell, mutating it, right? As you mutate it, if it stays dormant and it's not producing viruses, your NK cells aren't going to go over there and kill it, right? But it's still mutated. And now that mutated cell can reproduce itself, right? Eventually reproducing more of these virally infected cancer cells, right? That's how we get cervical cancer, right? Macrophages. So macrophages, large, avidly phagocytic, develop from monocytes, and the main job, phagocytosis, which means swallowing and eating and then killing of tissue debris, bacteria, viruses, right? Dead neutrophils there to prevent, right, any kind of further infection. And then they're going to process that information and display it. All right, what we're going to see is we need a way to displaying that virus so that all the T and B cells can recognize it. The weird thing is a T cell and a B cell, they have receptors already specific for the epitope, right? The weird thing is you might have a virus with that same epitope it recognizes, right? And then you have a T cell with the receptor recognizes that virus, but when they're kind of not displayed correctly, they can't match, right? So how do you display correctly, right? Well, a macrophage has to go around, swallow the virus first, kill it, and then it has to display that epitope on its receptor. Once it's displayed on a certain receptor in a macrophage, then the T cell can recognize it. All right, we call that antigen presentation, right? Because it swallows up the virus, which is an antigen. Now it's going to display parts of that antigen for our T and B cells. So then they can recognize it, right? That's antigen presentation right here. right? This antigen presentation will allow us to activate helper T cells and B cells, right? Lymphatic cells include dendritic cells. Dendritic cells found in the epidermis, membrane, mucous membranes, lymphatic organs, right? This is a little bit more specific. I'm not going to highlight these, right? Lymphoid tissue, aggregations of lymphocytes in various connective tissue of mucous membranes and various organs, right? So throughout areas where we have maybe direct or indirect opening with the environment, in your mouth, we have a direct opening to environment. So we're going to see, right, lots of lymphoid tissues that we call tonsils, right? In your throat, in the small intestines, where we have an indirect, right? The mouth brings it in, but then indirectly, you might have bacterium you're passing down into the small intestines, right? Well, we're going to have lots of mucosa associated lymphoid tissue, right? In areas that are indirectly exposed to the exterior, right? Again, right? Not gonna, this a lot of this goes into a lot of detail of like physiology, and 179 hopefully will take care of that. All right, so we have nodules, dense mass of lymphocytes and macrophages, right? Constant feature of lymph nodes, tonsils, and appendix, right? So these lymphoid nodules, when we look in the actual lymphatic node and tonsils, you'll see that it looks like they're circles of cells. Let me see if I can find one right here, right? You see how it looks like there's circles right here? Right here is like circular arrangement of cells. These are the nodules, right? What we're going to see is you have a lot of T and B cells surrounding it in dark purple. Lots of macrophage in the middle displaying any antigen, right? And it allows lots of white blood cells, these T and B cells, to congregate so then it can recognize macrophages that are displaying any of the virus, right? Now, coming back here, right? These are nodules. That's the only reason I'm showing you. These nodules are the circular arrangement, all right, of cells right here. Lymphatic organs, the primary lymphatic organs are your red bone marrow and thymus, right? This is where the cells are produced and become immunocompetent, right? Ever notice what we have T cells? You might have heard of T cells. What does a T cell stand for? All right. The T stands for thymic cells, right? B cells, bone marrow cells, right? That's where you get T and B cells. Now we have the primary lymphatic organs are where we form it, where they become immunocompetent, where become functional. Secondary ones are where you usually encounter the actual pathogen, right? Right. So these are your lymph nodes, tonsils, spleen. This is where we're hopefully going to be able to fight off the pathogen because we have such a high concentration of white blood cells there, right? So then by the time that lymph fluid, you get a cut in your arm, right? You need to get that lymph fluid back, right, to your subclavian. But we're going to bring it through a series of lymph nodes. Those lymph nodes are going to contain lots of white blood cells, right? As their bacterium in that cut, right? As we bring that fluid filled, right, bacterium filled fluid into the lymph nodes, the bacterium will get hopefully eaten up and destroyed by the white blood cells. So then the fluid leaving the lymph node will be void of the bacterium. It'll be clean. Right. Red bone marrow is involved in hemopoiesis and immunity. Again, right, they're just going to form RBCs and WBCs, right? They're different from bone tissue, right? As blood cells mature, they push their way through reticular endothelial cells that enter the sinus and flow into the bloodstream, right? Now, here's a red bone marrow. You have lots of fatty tissue, And then you have a lot of stem cells, right, inside of it that can turn into, right, that can turn into white blood cells or megakaryocytes. Right, thymus. Thymus, member of the endocrine, lymphatic, and immune system, right? It degenerates with age. It's found in the sternum, right? Babies have the largest thymuses, or right, when we compare it per body size. So babies have enlarged thymuses, infants have even larger ones. As we get to be 30, 35, the thymus starts to shrink. Once it gets to be 40, 45, right, it becomes scar tissue, right? So it shrinks and degenerates with age. It sucks, right? Right? So, yep. So what I tell you all the time about this, aging and all right, getting older is number one, everything slows down and you should just start sucking, right? And don't age, right? Was that? Yeah. Yeah, and disappears. And this one actually just becomes scar tissue. We don't actually know what happens to those thymic cells, right? Because even though we're like 50 years old, we don't have a thymus, we still have T cells that are maturing, right? We don't really know where they mature afterwards, right? When we look at the thymus, yeah, right? Skip it, just know in terms of what they look like and where it's found. All right. Lymph nodes, right there, know the function. 450, all right, and usually adults. Their main job is to cleanse lymph, right? That sounds so weird, right? By filtering any viral, bacterial, and fungal pathogens from the fluid before introduction of the fluid back up to the bloodstream. Because the last thing we want to do is bring that fluid without it being filtered and it has bacterium in it, right? We call that sepsis, right? That's not good. So what we're going to do is take that fluid, send it to a few lymph nodes. Any bacterium gets picked up by the bacteria, by the T and B cells and the macrophages. It gets swollen up and destroyed. And then the fluid that exits will be filtered of it, right? So now it's clean. We can actually just bring it into the subclavian veins and reintroduce that fluid back into the bloodstream, right? Right. Parenchyma divided into cortex, medulla, germinal centers where B cells multiply and differentiate into plasma cells. So this is where the B cells turn into plasma cells, and the plasma cells are the ones that actually produces antibodies. So the B cells by themselves don't produce antibodies quite yet. Only when we activate it, then they are going to mature into plasma cells. And then those plasma cells produces antibodies, right? And here are the lymph nodes itself right here. And with the lymph nodes, right, you bring fluid, that lymph, and that lymph could be full of bacterium inwards. And then you have all the white blood cells here that are able to filter it out. And then when all that fluid comes out here, it's going to be void of it. Perfect. Right. I'm going to stop right here. We'll continue, right, after our break. Right. Let's take a 30-minute break for lunch. I know I went fast, right? Yeah, right. Right.